Hello, everybody. This is Anand Nanavati here, and I'm helping the Ayurseva team with this session. Welcome to everybody. Gala sir, are you able to hear me? I'll just see if I can unmute you. Good evening, sir.
Good evening, Anand. Thank you
Sir,
very much for all your support.
we can hear you. That's great.
Yes, very good. Very good. થોડું blink થાય છે બહુ. એક મિનિટ blink ન થાય.
સર તમારો વિડિયો ઓન કરો ને. I hope everybody is ready with their questions. Sir is full on एकदम ready after a big vacation. आप लोग के सबके questions discuss करने के लिए सर एकदम ready है. तो I hope everybody has their questions all ready. Charu Ben, you had lot of questions which Snehil and myself had answered, but you can ask those questions again to sir. रूपाली आपके भी बहुत सारे questions थे. You can ask those questions.
Yeah, I have allowed mic for Charu Smita.
Okay. Hello, everybody. Nice to meet everyone after such a long time. તો સર હમણાં questions ચાલુ કરી શકે?
So before we start off, I just wanted to let everybody know here that if you want any assistance with your mic, if you want to make me unmute you, I will just put a message in the chat and I'll do it. I'm monitoring the chat actively.
Sure.
Yeah.
Thank you. Yeah.
Hand raise also is fine, na, Anand? If someone raises his hand or hand,
Yes,
so you
yes.
can.
I'll be monitoring that. Yes. Yeah.
હિમા હું બોલું કે?
એક વખત સર ને એમની સ્ક્રીન ચાલુ કરવા દો because we don't know where sir is. Probably he is not there.
Yeah, we'll just hold on for a
Just a minute, I'll
few
call
seconds.
him up and confirm that.
Yeah.
Sure.
Thank you, Hima.
Anand, many participants are not able to connect the audio. उनके microphone के side में there is a circle and cross. Same is with the sir, Gala sir. So is it issue with our side or from their device?
No. I just need to enable their mics actually.
So Sanjana Bole, Rupali Patil.
I'll allow mic for everybody. Yeah.
Okay,
I'll
and Gala
allow.
sir also.
Yeah. I'll do that for him first. Oh, it was allowed, but yeah. Okay. Now it's there. Okay. I'm allowing for all.
પૂછો.
હા હેલો સ્નેહલ અવાજ આવે છે?
Sir, we are able to hear you. Yes.
ઓકે
અને can
ઓકે
you see me? પૂછો.
દેખાય છે?
Screen, can you see
સ્ક્રીન
me?
દેખાય છે મારો?
No, sir. We are not able to see your screen. Like, we are not able to see you, your camera.
કરું છું કે?
He is not able to see the camera. હવે
Turn camera on. એક minute. Now.
now can you see?
Yeah, something is coming up. It's just hold on.
કરું છે તો.
નહીં just hold on નીચે.
ऐसे ना कर. ऐसे ना कर. जो बराबर है उधर ही होना चाहिए.
થોડો પંખો ઓછો કરી. પોતે જ
नहीं मैंने स्क्रीन तो फोटो भेजा थी. कैमरा और माइक दोनों ऑन है बट यू कांट सी है.
Trishla, I'll just call you up, okay?
प्लीज. और यहाँ से सब ऑन है. क्या करूँ मैं अभी?
I'll just call you up on this. Yeah.
But we can see
Just
sir
call you
also and we can hear his voice also. That's it. Trishla, we can hear him. Sir, તમારી સ્ક્રીન દેખાય છે. તમારી સ્ક્રીન પણ દેખાય છે. ફક્ત ફોટો ફ્રીઝ થઈ ગયો છે. હા ને?
હા શું કહ્યું?
Sorry everybody for the technical issues. We are actually using a new app right now,
अच्छा,
so
अभी बीच में
there
screen
can be
में
some
stutter हो
technical
रहा है.
issues. Hold on for few more minutes
And
and then we will start the session.
what I'll do is I'll leave from this. I had actually agreed to it before, but I'll again start it. Hello? Yeah.
I just talked to Trishla, so they are starting off again in a few minutes. Till that time, we'll just hold on.
Good evening everybody. Actually we are meeting sir after a time of 1 month. Many sessions were there without sir and me, Hima madam, Ashish sir and Avdut sir tried to cover up many topics. But same questions, if you want to ask, sir, you can ask. What you can do is raise your hands. Anand will unmute you one by one, and you can go on with your question. Sir will answer it. Once you are done with your question, please make sure you lower down your hand so next person and Anand does not get confused by that. So one by one, we can go question answer session.
Snehil, actually, I've enabled mic for everybody. So once they are done with their questions, they can mute themselves. Yeah. Okay.
आवाज आ
Recording.
So, sir, we can hear you. Yeah.
yeah.
Can you? Okay. Yeah. You can see him.
સ્નેહિલ દેખાય છે મારું?
Please.
No, sir.
No. Turn camera on. Now, can you see him? No. Can you hear? Can you hear me? Okay.
We can hear you, but we cannot see you.
That's funny. I've been like, I've actually switched on everything, the video, audio, everything. It still says that you can't see him.
So Trishna is it on a phone or
You can share.
ના
You're a presenter.
I made
How do
Dr.
I-
Gala as presenter as well. Yeah. So you can actually, so on the top side, you will see a share. If you want to share screen, share your screen.
Go to check
share. You can use the share and screen.
screen. No.
Here, share.
But that's not what you need to do. Just a minute.
पीछे share.
Share करो मैं करो करना.
If you want to share your,
Share screen.
if you want to start the
Share
camera, then there's a
video,
separate button
video
for
करना,
camera.
share.
Share पर हमें press करियो.
Yes, sir.
सीधा चला गया.
कभी गई
Okay.
એમાં સંભળાય છે એમાં?
So we can hear you. Hearing is not a problem.
Okay.
Yes, sir.
Okay, but screen
Only
share
the camera. Sir.
Camera.
So there's a button for sharing. There's a button called
તમે
share.
કર્યું sharing.
Acha,
હા એ કર્યું. Screen window or tab
मैंने वो कटा ना WhatsApp में करते हुए.
करो.
वो नहीं जो लिंक. विपशना जो ग्रुप है डैडी करते हुए. ये है. हाँ ये लिंक करते हैं ना.
Here Microsoft Team.
Okay.
अभी थोड़ा पंखो स्लो कर दे तो बंद कर लेना. અહીંયા हाँ.
સર ભલે સ્ક્રીન નહીં દેખાતી સ્ટાર્ટ કરીએ બીકોઝ ઓલરેડી 20 મિનિટ્સ નીકળી ગયા છે તો
हाँ ठीक है चालू करेंगे. स्टार्ट करेंगे. Start
You
करें.
can start with your questions.
Good evening, sir.
Go on करो, at least sir ने तबे तो देखा सो.
Okay, let us start.
Is it seen here?
Hello, sir.
Hello.
Sir, good to see you after such a long time. And how is auntie? I'm sorry
She's
about
fine.
asking informal questions, but I just was worried what happened.
No, she's absolutely fine. Yeah.
Okay, sir.
Thank you.
સર તમારા એબ્સન્સમાં તમારા સ્ટુડન્ટ્સે બહુ સરખી રીતે અમને બધું એક્સપ્લેન કરેલું છે પણ અમે લોકો અને એના લીધે જ અમે રેગ્યુલરલી નસ્ય રોજ કરીએ છીએ. મેં તો એક ડાયરી બનાવી લીધી છે અને રોજ સવારના બની જાય છે ગુડસુંઠી અને બધા પેશન્ટ્સને હું આપું છું. સો ઓબ્ઝર્વેશન સારું છે પણ મને તમને એક ક્વેશ્ચન પૂછવું છે એવું કે આશ્યોતન હરેક પેશન્ટમાં જરૂરી છે કે આશ્યોતન બધા પેશન્ટમાં જરૂરી છે?
એક મિનિટ
સર
એમને કહી દે ને કર ગમે
Sir, we are able to hear you and we are able to see you as well. So it's going great, sir.
ચાલુ કરી हाँ जी
હા સર. સર મને પૂછવું છે કે અમારા ત્યાં છે ને અમરાવતી being a small city, people many of the patients prefer coming to my clinic to put gurshunti every day.
અચ્છા
અને પછી થોડા રિલક્ટન્સ સાથે પછી ઘરે કન્ટિન્યુ કરે છે. તો જ્યારે ઘરે કન્ટિન્યુ કરે ત્યારે આશ્ચોતન પણ સાથે સાથે કરવું જરૂરી છે કે ખાલી ગુડશુંઠી નસ્ય સફિશિયન્ટ છે?
આપણે શા માટે ગુડસુંઠી નસ્ય આપીએ છીએ અને શા
શોધન
માટે આપવું જોઈએ?
હા
Sir, Hindi, because lot of participants will not understand Gujarati.
ઓકે.
ઓ
There are people who will probably not understand. मतलब Maharashtrian ઘણા બધા લોકો છે, they might not understand.
Okay. See, what is the purpose of giving nasya, first of all?
It is to do to clear up the srotases. Shodhan.
What srotas?
शिरोवह स्रोतस शिरस्थान में जे पण में जो भी स्रोतस रहते हैं दो स्रोतस भी clear थे.
Right. So what happens when we put Ashyotan?
Triphala will clear up the channels which are connected to the nose and which are connected to the eyes.
Ashyotan is essentially activates the brain.
Pardon, sir? I can't tell you.
Ashyotan can activate the brain. Ashyotan can also activate the brain.
Okay.
So when we are giving Sodhan Nasya, that time when we give Ashyotan, patient also feels the similar effect, like lightness in the eyelids, freshness in the eyes, and more clarity. You are getting my point?
Yes, sir.
So initially patient may have, it is difficult to convince the patient to put the Ashyotan. But once you put for few days, patient will keep coming to you for Ashyotan and for Nasya. Initially, there may be apprehension.
Sir, there is no apprehension, but they feel that it is too much of a task to make both the things at home.
Okay, so what you can do, you start with Nasya. Don't worry about Ashyotan for few more days, maybe for few more weeks. Once they are convinced about Nasya, particularly Sodhan Nasya, they will develop more confidence in your treatment.
Okay.
They will bring many more patients just for this purpose.
Okay.
Once they get the confidence, then slowly later on you can introduce Aschyatan.
Okay, sir.
Ultimately, we don't want to sell our Sodhan Nasya in Aschyatan. Are you getting my point? We are giving extra benefit to the patient.
Yes.
समझ पड़ी?
हाँ, समझ पड़ी, sir. Sir,
Right.
there is one more question.
Yes.
There is one patient. He is having diabetes mellitus
Hmm.
since past 3-4 years, and according to me, it is stress induced because he was a highly ranking officer in the administrative services, and it is during that period that because of the stress he developed, because his lifestyle was totally normal. He was eating proper food and he was keeping a good lifestyle. So now he has retired, and I have put him on. He was, when he came to me, he had his doctor had put him on insulin also night at a night in the night, and he was having hypoglycemia. So I stopped his insulin and I put him on oral Ayurvedic hypoglycemics, and I also gave Shodhan Nasya. So my question is, ki after, so you can hear me, no?
I can hear you.
So he has been regularly coming for Shodhan Nasya, but what he says is that his blood sugar spikes up to 180 in the morning, fasting blood sugar, even if he has eaten a light diet. And what I keep telling him is, because this is stress induced, it will take some time. So it is okay to wait for some time before even if his fasting sugar is a little bit high, like 180, 190. Should I keep on giving him Shodhan Nasya for some more time and wait till his HbA1c is normal?
Good point. Good point. You are giving Sodhan Nasya.
Yes.
At the same time, you are talking about his stress level,
Yes.
and you are connecting his diabetes with his stress condition.
Yes, sir.
So you want to treat diabetes or you want to treat the stress?
Because diabetes is stress induced, I need to reduce the stress, but I have asked him to take Ayurvedic anti-diabetics because he doesn't want to take insulin continuously. So can't we do both?
No, there are two.
Hello.
Uh, yeah, I think we'll have to wait. I think Dr. Gala's phone looks like it is frozen. Ma'am, just hold on.
Yeah.
Once we are done with Nasya part, na, we will be taking Ashyotan, and not only plain Ashyotan. Okay, sir is back.
Hello. Hello.
Yes, sir. Yes, sir.
Avis.
Yes, sir. We can hear you and we can see you as well.
Okay. Sorry.
Yes, sir.
Sorry for the interference. Ave, there are two things you have to think of.
Okay.
On one side, he has got diabetes on treatment like insulin. On the other hand, he is a stressed person. So it could be stress-induced diabetes, right? So diabetes part, you don't worry. Let it be initially tackled by his physician, diabetologist. You take care of his stress level.
Okay.
So how many drops he required for
16.
the soreness?
16 drops, 8 drops in each nostril.
Okay. You always talk only how many drops in one nostril?
Drops in each nostril. Like that, I total 16 drops.
Okay. So forget about the Southern Nasya initially. Let it be
Okay.
covered by a physician. Right now, you take care of his psyche, his depression, or his stress level.
Okay.
So here, instead of Southern Nasya, you may give Shaman Nasya.
Okay.
Try either good Sunti Grit Nasya or Panchagavya Nasya.
Okay, sir.
Right? Now,
Yes.
while giving Panchagavya Nasya, his mind will come under control. Stress
Okay.
level will get reduced for a day or two. Right? What you can do later, Ratna, nighttime you can give Panchagavya Nasya, right? Or
Yes.
good Sunti Grit Nasya.
Okay.
Daytime you can give Sodan Nasya.
Okay.
And you see the once he is asleep with Sodan with Shaman Nasya, he will have good sleep at night. His stress level will reduce. So when he gets up in the morning, after breakfast, you can give Sodan Nasya.
Okay.
All right. There may be little variation as you see the response from the patient on day-to-day basis.
Okay, sir.
Right. Then
Okay,
you can
sir.
again discuss further.
Okay, sir. I'll
Right?
do that. Yes, sir.
Right.
Thank you, sir.
And Haji, another variation is morning you can give good Sunti Grat Nasya or Panchagavya Nasya. After about half an hour or 1 hour, you can give Sodan Nasya. And at bedtime, you can give Gogrut Nasya.
Okay.
That also
Okay,
would
sir.
work wonder. It would work wonder. You have taken care of Sodan also. You have taken care of stress level also.
Okay, sir. I'll do that.
Right? You make a note whatever changes you are feeling in the patient. He will tell you
Okay,
whether
sir.
he feels relaxed, and once he feels relaxed every single day, then his sugar levels should come down automatically. So don't allow the patient to get into hypoglycemia. So once sugar levels are down, reduce the dose of insulin.
Okay, sir.
That exercise you should follow. Explain the patient once his sugar levels goes down, immediately khadi sakarno powder, misri powder should be mixed in water and he can drink. So immediately he will not go into hypoglycemia. Then next day you can check his blood sugar level and then adjust the dose of insulin.
Okay, sir.
So as the stress level goes down, his sugar levels will also go down. Accordingly, his treatment for the diabetes also should go down.
Okay, sir. Sir, I'll keep you. I'll keep a
Okay.
track and I'll let you know after some time.
Okay. Okay, Charu.
Yes.
Okay.
Thank you. Thank you,
Right.
sir.
Thank you.
Uh,
Yes.
yeah, Gala sir. So next question is from Dr. Anju Chetia.
Sorry, then Fatakra. શું કે છે?
We have a question by Dr. Anju Chetia.
Doctor?
Anju Chetia.
हाँ जी, हाँ जी. Yes. Tell me the question. Hello, Anju ji.
Dr.
Anju, you
Anju,
are
you may have to unmute your mic. Yeah.
Hello, sir.
Hello, hello.
Namaste.
Namaste ji. How are you?
Sir, I'm fine, sir. How are you?
Fine, fine. Thank you very much.
Yeah. Sir, I wanted to ask, Like when we are using Gur Shunti Nasya, and then when we ask the patient to do it at home, compared to Shunti Pradaman Nasya, Gur Shunti, people don't want to prepare at home. They don't mind to do Shunti Pradaman at home, but Gur Shunti is a challenge for them because they don't want to take the extra effort of preparing it. So, sir, in this case, Shunti Pradaman, if we have already given, we are giving the patient Gur Shunti, we are finding good results. So later, how can we, I mean, if patient doesn't want to prepare, what is the other option? Can we go for Shadbindu or Vacha Tail Nasya for Shodhan purpose if we still feel that Shodhan is necessary?
If patient feels comfortable after giving good Sunti Nasya in the clinic, for few days, within few days, he will develop more confidence.
Yeah,
Can
so,
you
so
tell the
like
patient that preparation for good Sunti Nasya will take lesser time in preparing 1 cup of tea?
yeah, sir, but certain patients, they are very,
It
very
is all up to
stubborn.
your conviction. How best you can convince the patient. Patients are ready
Sir,
to get the results, and there is no replacement for good Sunti Nasya as a good Sunti Pradaman Nasya. There is specific indication for Sunti Pradaman, specific for good Sunti Nasya. Don't interchange. Only
okay,
in some emergency cases you can use Sunti Pradaman, but otherwise good Sunti Nasya is safer to use than Sunti Pradaman itself.
fine. And sir, one more question. Like once the patient, like they were feeling like irritation in this area, in about say 10 or 12 drops. Later, see the irritation is like in 2 or 3 drops. Okay, so sir, when such a thing arrives, can we just after this switch to Shaman Nasya?
Very good. Rather, patient now doesn't require Sodhan Nasya, patient requires Saman Nasya. Right? Now, what you can do, what I do, I'll just share it with you, with everybody. When such situation arises, that means patient is slowly coming out of Samavastha and reaching it almost near Niramavastha. So you should be prepared. Now patient doesn't require Sodhan Nasya every day. What you can do, use Shaman Nasya, just see the result. After about 15 minutes to half an hour, then you can give good Sunti Nasya. Double effect. And patient will
Okay.
feel very comfortable, very much relaxed. So we are
Mm-hmm.
combining Shaman and Shodhan Nasya.
So that means once the 2 drops irritation arrives, better to go for Shunti Grutnasya.
Good Sunti Grit Nasya or Panchagavya Nasya
Pancham.
initially after breakfast. Then half an hour later, you can give good Sunti Nasya.
Okay.
Or if you doesn't have any confidence, then use um, Panchagavya Nasya for a day
Mm-hmm.
or 2 or 3, maybe, and calling the patient again in the clinic. Then you put Panchagavya Nasya, and 15 minutes later, or ask the patient to put the Panchagavya Nasya at home. Then you call the patient in about 1 hour's time. Then you put good Sunti Nasya again
Mm-hmm.
and see the response. He has already put the good Sunti Gurita Nasya or Panchagavya Nasya at home for 3 or 4 days time. Then afterwards, 4 or 5th day, you can call the patient in your clinic and you put Sodhan Nasya as a good Sunti Nasya and see the response. Ask the patient how you are feeling now.
Okay.
After this combination or few more days, then probably
Okay.
patient may not require Sodhan Nasya at all. You can keep putting Shaman Nasya for few more days. Later on, I'll tell you that later on when patient feels absolutely comfortable, good sleep at night, most relaxed mind, Then once in a while you can put Gursunti Nasya to wipe off the excess of Shaman Nasya.
Okay,
Then patient
fine.
will flow very nicely. So
Understood.
different approach in same patient at different timings. How
Okay.
to wean off Shodhan Nasya, how to wean off Shaman Nasya. Once in a while, again put Shodhan Nasya just to check or to wipe off the excess of Shaman Nasya or Bruhan Nasya.
Okay, sir.
Right?
Thank you, sir.
Once you reach that stage, when you feel patient is doing very well, no symptoms at all, good sleep at night, quite relaxed mind, then you can switch the patient on Bruhan Nasya. Bruhan Nasya you can put 2 or 4 drops or Go Grut Nasya every night. Again, once in a while, you put Shodhan Nasya just to check. You get my point? Are you getting me or not?
Yes, sir. Yes, sir.
Then you can make pattern of Nasya for that patient,
Okay.
right?
Right, sir. So intermittently, Gurshunti can be used even if we have started with Shaman Nasya
No
or
problem,
Bruhan
no
Nasya.
problem. This is to check whether a patient now also
Now,
requires Shaman Nasya or still requires Shodhan Nasya. Number two, you are wiping off the excess of Shaman Nasya or Bruhan Nasya in between when you are using Shodhan Nasya.
yeah. Understood,
Yeah?
sir. Because sometimes if the doshas again become lean, then it is better that we can do the
Yeah,
Shodhan in the clinic
yeah,
itself.
yes. After doing
Mhm.
this for few days, once you reach the patient from Shodhan Nasya to Shaman Nasya, from Shaman Nasya to Bruhan Nasya, and in between you are checking it with Shodhan Nasya, within a month or so, patient will learn by himself what to put, when to put, how many days to put. So you are teaching the patient the correct way of using Sadhya Nasya.
Fine,
Clear?
sir. Thank you, sir.
Okay, most welcome.
Sir,
Right?
Anand here back again. Dr. Aman
Ah,
has a question.
yes. Aman, હમણાં હતી એને?
Hey,
Oh,
Good
hi
evening,
Aman.
sir.
yes, yes.
Good evening, sir.
Good evening, Aman. How are you doing?
I'm good, sir. How are you, sir?
Fine, thank you so much.
So good to see you after so many days.
Yes, same here, Aman.
Sir, actually, I have a patient. He has a very Ajib complaint. Like he said, ki few years back, he was involved with someone, and that girl has left that guy, and due to that, he has put some acid on his face. But
Mhm.
I cannot see that it is actually acid. He approached me because of he has got a lot of melasma and pigmentation on his face, and now he's married and has got kid also, and now he wants that his face should be okay. So I asked him to open his mouth. So he said that he cannot open the mouth also. I wanted to check his tongue basically, but he said that he cannot even open the mouth because all restricted. But when I took the history, then it's not like he has it is really something acidic, otherwise his face would have burnt, but it's not the acid marks, it is something else as I guess, and he's not telling the truth. Then I asked him, do you eat tobacco or something? Then he says, yes, I constantly smoke and eat tobacco. So according to me, because of lot of tobacco chewing, it has got constriction inside, and he cannot even open the mouth. And in during the history taking, I also found that he's saying that I have constant heartburns, lot of acidity is there, and even if nobody asks me for the food, I can live without food even for 1 or 2 days. And a few years back he used to get constant headache. So sir, in this patient, should I start with the shaman nasya or shodhan nasya, because I'm
What?
confused.
Yeah. What do you think his condition would be?
I think
Samprapti.
he's in depression also, and he
Very
says
good.
that all night he cannot sleep. He thinks about that girl also, and he sleeps around 4 or 5. He is not actually ready to move on. and rest is the stories he's making about, maybe he has put something bleaching agent or something, but it's not total acid, but it's more a mental thing is there.
When did he get the acid attack,
I think,
so
sir,
called?
he told me like 3 or 4 years before.
Okay. Now all the chances that he could be in depression.
Yes, sir. He is in depression.
Now your duty as a clinician, you have to give him a good sleep at night.
Yes, sir.
First, to start with sleep, he should sleep properly at night. So he should get up with fresh mind in the morning. So his thought process, which was negative, can become positive slowly.
Yes, sir.
So either you can give um, Panchagavya Nasya, right? At the same time, Astyatan also for a few days. Then once in a while, once in 5 days or once in 7 days, you can use Sodhan Nasya at that time. Don't start with Sodhan Nasya right now. Otherwise, he will get into more Karsan Avastha.
Yes, sir.
So give Shaman Nasya. Now after 5 days or 7 days, you put Sodhan Nasya and just see what is his actual situation at that point of time. Then you can decide whether he needs to be put on same Shaman Nasya or he may require Bruhan Nasya. Again, in between, in a week's time, once in a week, you can just put Sodhan Nasya, as I spoke little earlier.
Yes, sir.
Right. First, if he gets proper sleep at night, his thought process will become little more rational. He will become little more positive, and he will find it easier to forget about the past.
So,
Just
how
give
many
good sleep at
drops
night.
of Panchagavya I should start with?
Uh, that also depends what is his uh, Puris Parikshan.
Okay.
Whether there is any Vatanuloman or Vat Pratiloman, what is his level of hunger, that also would decide. If he is not feeling hungry, then he won't be able to digest even more than 4 drops of Saman. If he is feeling hungry, then you can give 6 drops, or maybe I give even 8 drops. But you
Okay,
can
sir.
start with 4 drops initially for a day or two. Then you may switch over to 6 drops. If he is nearby, you can call him in between for follow-up.
Sir, at
So
bedtime
every
only.
those are to be put at bedtime. I given even Shaman Nasya in the morning, then Sodhan Nasya in the afternoon, and then Bruhan Nasya at night.
Yes, sir.
But I will not recommend you to use in this pattern. Wait for a week or two, and then you will be able to decide what is to be done.
Okay, sir.
Followed,
Yes, sir. Thank you, sir.
right? Most welcome. Take care. Yes, Anand.
Yeah, thank you, sir. So, if anybody has any questions, please raise your hand, or you can just unmute yourself and you can start talking. Okay, looks like we may probably not have any more questions. Dr. Hema, would you want to
Uh,
share anything
um,
that we need to? Yeah, Dr. Anju, please go ahead.
sir, one moment. Sir, some of the
Anand.
patients, they don't feel irritation here, but they feel irritation in along the eyebrows, here in the ears, here at the back, but they don't feel irritation here even after 10, 12 drops, or even like 15, 16 drops also. They feel irritation here.
Okay. So you're
So
talking
what
about
we do?
good Sunti Sodhan Nasya?
Yeah, good shunti I'm talking about.
Fine. So he could be having still more block in the sinuses. It may be reaching a maxillary sinus, but not reaching the frontal sinus. It may be reaching the mastoid sinus, not reaching the frontal sinus. So you go on putting the drops. At one point of time, after a few days, it will start reaching here. Don't be hurry in changing Nasya.
Okay.
Now, To
So,
increase the efficacy of the Nasya, I'll tell you one more angle. To improve the efficacy of the Nasya, when it is not reaching even after 1 week, not reaching the forehead, then what I do usually give Shunti Pradhaman Nasya
yeah,
initially. Ask the
okay,
patient to wait for 15 minutes. And then you start putting good Shunti Sodhan Nasya. Both are Sodhan. Initially is only Shunti Pradhaman. After about 15 minutes or so, give good Shunti Nasya. Then the chances of reaching the forehead or the hairline are more. It will shorten the duration of using the Nasya. And he will get
okay,
better result and faster result.
fine.
But before that, make sure his BP is normal.
Yeah.
Right?
Okay, sir. Yeah. Thank you,
Okay.
sir.
Okay.
Sir, on behalf of participants, I will be asking a question. Um,
Who is the
there is a
participant?
I'm asking this question because I have listened to all the questions that they have asked. So probably after a few days, this will be the question that will come. But I am asking that question instead of them.
Okay. Okay.
After practicing, they will have this question. For a patient, we start putting Gud Shunti, and there is a day when only एक ड्रॉप में नस्य चला जाता है ऊपर. It hits you. For 3-4 days, weeks together, it's just one drop over here. Now after that, we give Shaman Nasya or a Shodhan Shaman Nasya. Example, if we start giving GGS or Gud Shunti Grit Nasya, or we give Panchagavya Grit Nasya. Now after putting that, the patient feels very good, but there is a lot of phlegm that starts coming out. And if you put GS after that, then the drops come to around 7, 8 or sometimes 10 also. But the patient says the patient feels very light after putting the Grit Nasya. Now, how do we interpret this? Initially, it was only one drop GS. Then we started putting the Shodhan and Shaman Nasya. And then there is lot of phlegm which keeps coming out only on putting the Nasya.
It's not clear. Shodhan and then Shaman, or Shaman and then Shodhan?
First it is Shodhan, Gud Shunti Nasya. Then you give
Good Shunti,
GGS.
one drop.
One drop. GGS, you put 2 drops, 4 drops, patient feels very good. Lot of phlegm comes out at that point of time. If within half an hour you put Gud Shunti Nasya again, then the drops would be somewhere around 6, 7, 8, 9, 10, somewhere around 12. But evening again you put, it is all gone. It is only one drop again. So next day again the patient puts Panchagavya Grit Nasya in the morning. Does again after half an hour he puts the GS. Again the drops will be 7, 8 drops. Now how do we interpret this? Why is this happening that again in the evening the GS is only one drop?
Very good point. I think the Vaidya who has asked this question is really practicing Nasya. See, a sequence of events are like this. By putting one drop of Gud Shunti Nasya initially, patient feels it is reaching the top of the head. Right. So obviously, patient has to be on Shaman Nasya for a day or 2 or 3, and then you put Shodhan Nasya. Right. Now, question is, first of all, how concentrated is Gud Shunti Nasya? If it reaches for the first time, one drop reaches the top of the head, either the drops are very much concentrated than required, so one drop will reach, rather it might even irritate more. If it irritates more, then the drops are very much concentrated. So make sure the drops are prepared properly. Then try again how many drops are reaching the top of the head. This is one point. Second point, after reaching one drop of Gud Shunti Nasya and then patient is on Shaman Nasya, and then if in the morning only after half an hour you put Shodhan Nasya, and there are many drops required to reach the top of the head. That means the the doctor has put little more number of drops, Shaman Nasya drops, which requires more Shodhan Nasya drops to dilute or to titrate the Shaman Nasya dravya. This is second possibility. I feel personally that he is preparing, that patient, he or she is preparing concentrated Shodhan Nasya, Gursunti Nasya. I think dilute it at least by double the amount of water and less amount of Sunti. And then you think, put it again and then you record the changes. It would get rectified. I think properly made Nasya will be useful. It may be too early to put the Shaman Nasya. Correct the procedure of making Shodhan Nasya. Right? The answer will be there. And then if still there is problem, then let them come with a question.
Okay. So this question was asked by a Vaidya practicing in London. So I will pass on the answer to her. She could not log in today because I think she had another meeting. That's why. So she had posted this question.
Good. I think correct procedure to prepare the Nasya, Gursunti Nasya, would solve the problem. I have strong doubt that there are very much concentrated Gursunti Nasya, where one drop hits the top of the head. That shouldn't happen on first day.
Okay. No, the Gurshunti Nasya did not go on the first day. Sir, is there any possibility that the Shodhan Nasya or the Shodhan Shaman Grit Nasya which we are putting is probably pulling out the lean doshas which have been sitting for long, which have been dried up because of Vayu sitting in the sinuses
Quite
or in
possible. If there are lean dosas and a lot of cough comes out, then all the more reasons that this concentrated drug Shodhan Nasya is creating that problem. Then by parting good Sunti Nasya, good Sunti Grit Nasya, again lean dosas will come out. Try with proper preparation of the good Sunti Nasya and then see the result. Then she can communicate again after a few days.
Okay. Sir. Dr. Rupali Patil. Dr. Rupali also had a lot of questions last time. Dr. Rupali, please unmute yourself and ask.
Yes, Lina. Hello, sir. Good evening.
Hello. Good evening,
Yes, sir.
Rupali.
Sir, nice to see you after a long time.
Same
Sir,
here.
I had many questions, and Snail sir and Hima answered them really very well, because when you were not there, these people conducted session really well, and at that time, I asked many questions. And sir, now I wanted to ask one question, but Dr. Anju already asked that, and you answered that well. So in the beginning, when we started these sessions regarding Nasana, there is सर ऐसा था कि कुछ क्लैरिटी नहीं है, समझ नहीं रहा है क्या है, बट नाउ एटलीस्ट वी नो, आई नो द बेसिक कि हाँ ये कब करना है, ये कब करना है, अभी गुरशुंठी डाल के हम लोग एक्चुअली क्या समझ में आता है या. बट सर इन आई हैव वन पेशेंट, actually he's Hima's patient, my husband. After so many months of treatment, we are putting good Sunthi, means every time when we visit Hima's clinic, she puts good Sunthi. But sir, after 8 to 10 or 12 drops also, it is not reaching to the top. And then she's giving different Nasya tablets, and we are doing Nasya regularly. But somehow the sinuses are not opening. So my question is, such patients, really some patients take this much long time to respond.
Okay. First of all, clear with two more points. We have to be careful with VIP patients. Are you getting me?
Yes, sir. Yes.
We have to be careful with VIP patients. Patient is your husband.
Huh.
He is VIP. Right. Secondly, since how many months you are practicing Nasya?
Sir, I am practicing means that aggressively. You can say with preparation of good shunti and all that since last 1 month only. But he is taking treatment of Hima since last 4 to 5 months. And for
Okay.
him, we are doing it regularly. Yeah.
Okay. It has taken many more years to reach this level. All of us. Many more years it has taken to reach this level. So you need to practice more and more and more. Right. Now your question is also important. Why it is not reaching the top of the head after putting for so many days? The correction can be either you can increase the concentration of the Nasya. One angle is to increase the concentration of Nasya. Second angle, either you put Sunti Pradhaman Nasya first. After about 15 minutes, you put Sodhan Nasya, good Sunti Nasya. Double effect. Are you getting my point, Rupali?
Yes, sir, I'm getting your point. My question is that only ki why he is taking so much time because we are using Nasya regularly.
It may be.
So yeah.
It may be blocked. There may be a big block. Another point to confirm, is he sleeping little more than required?
Yes, sir.
Number one. Number two, he feels little lazy.
No.
He's not lazy.
No.
Does it take longer time to decide for anything? He cannot take prompt decision.
No, it is not like that.
He's not like that. I think you can try, go Pradhaman, and after about half an hour or so, give Sunti good Sunti Nasya, and you see the response. Either he could be having a lot of samavastha, or he could be having a lot of kapha, that means sinusitis. So try this. Third point. I don't know what is his samprapti. Third point, you can give Sadabindu Tel Nasya. Sadabindu Tel Nasya, 6 drops. Wait for about 1 hour. Then, if necessary, you can put good Sunti Nasya.
Okay.
This is another way of treating this patient.
Okay.
Don't be harsh on him.
Hello, sir. Sorry.
Don't be harsh on him.
No, sir. I'm just asking because in my case also when I put the Dursunti Nasya for me, it took 8 to 10 drops to and then also I couldn't feel anything on the top. But after some days, 1 or 2 drops were sufficient for me. But for my husband, because he is complaining of migraine all the time, he is taking treatment for migraine only.
Oh.
So why it is not reaching after so much of treatment? Yeah.
Okay. Is there any acidity? Pittadikya?
Not as such. Pitta is there, but we don't have burning or regurgitation or burping. No.
Has he got anuloman of Vayu or Pratiloman? If there is Pratiloman, you have to correct the Pratiloman Vayu. Make it anuloman and then put the Nasya, it will be easier.
Okay.
Or else, if there is a Pitta component also, then you can use Panchagavya Nasya and followed by good Santi Nasya. So it depends, what samprapti you've got from your husband.
Sir, I will interrupt because I know the patient. So you can give her a better, because then it will be clear in her head. He still has not covered up the urgency stage. હજી બી urgency છે, super sam અવસ્થા છે.
Okay.
Super sam અવસ્થા છે. અને urgency ની
So
stage છે.
you can use Sadbindu tel
ચાલુ છે.
for a couple 2 to 3 days, and then followed by 1 hour later by good Sunti Nasya. I think that should work. And correct Samavastha, correct urgency also. When there is
Correction છે,
urgency,
sir. Gradual
when,
correction is there, but સામાવસ્થા
Yeah.
આટલી બધી છે તેમાં ડબ્બો ખાલી થતા વાર લાગશે.
okay, no problem. So Sadbindu tel will work, followed by good Sunti Nasya. Right?
Yes, sir. Sir, in skin problems, especially melasma, hyperpigmentation, what should be our approach in terms of Nasya?
Mostly Saman Nasya, in between Shodhan Nasya.
Okay.
Best for pigmentation, best is Kumkumadi Nasya. Kumkumadi Nasya. Or simple kumkum to be boiled with a go dugdha and put the Nasya.
Okay.
If you don't get Kumkumadi Nasya.
Okay.
Right?
Yes, sir.
What else?
Sir,
Sir,
Anand here. Yeah.
Anand?
No.
Yeah. Dr. Rupal, please go ahead.
Sir, my simple question is that means you will sound this very funny, but if we go wrong in assessing the patient, any very sound patient, if you are not putting Shodhan Nasya or we are putting Shaman Nasya, so what will be the side effect of that? Maximum side effect, what will happen? That I want to know.
Can you repeat the question, please?
Sir, if you go wrong in assessing the patient, and if the patient has samata, and in that case, if we are not putting Shodhan Nasya and we are giving Shaman Nasya, so what will happen to that patient?
What should happen? What can happen? Patient will get Gaurav,
Guruta, yeah.
Guruta in the head. He will become more dull. There will be more dullness, more heaviness. There may be dizziness.
Okay.
So always counteract with Shodhan Nasya. As we have discussed, Shodhan Nasya can be used as a diagnostic purpose as well as therapeutic purpose. Now, diagnostic purpose can be used in this case when you put Shaman Nasya for longer time than required. Put Shodhan Nasya to check whether there is any excess of Shaman Nasya or Brohan Nasya. So that gives you diagnosis. Whether you can continue with Shaman or Brohan Nasya, or you have to come down to Shodhan Nasya. So Shodhan Nasya will give you diagnosis, at the same time treatment. Right?
Sir, for working patients, in some patients, it is not really possible for make Guntunti Nasya every day for them at home, or it is not possible for them to come to clinic also because they are working 9 to 5 or 9 to 7, whatever. So, what is the other option that we can suggest them to take at home with the other options?
Okay. I usually tell my patients, if you are not drinking tea or coffee in the morning, then you need not take the Nasya. But if you are having tea or coffee in the morning, might as well prepare good Sunti Nasya. It takes lesser time than preparing 1 cup of tea. Only it requires, for you to convince the patient properly. Gain little more confidence from the patient. Patient will start preparing even if he has to leave early in the morning. It is not a rocket science to prepare the Nasya.
That is true, sir, because the same answer you gave to Dr. Anju also. But what we see in day-to-day practice is the Indian ladies, sir, when it comes to ladies especially, they do everything. They will do everything for their family, for their husband, children, everything. But when it comes to them now for doing something for themselves, तो ये हो जाता है कि start कर देते हैं, फिर वो continue नहीं हो पाता सर.
Okay, you can tell the patient to at least start the Nasya on holidays, weekends, whenever it is possible. Right? Slowly patient will get convinced. Patient may not get convinced immediately. Give at least on Saturday, Sundays when he is off. Or else, if he is coming in the evening, then that time also you can prepare the Nasya and put the Nasya.
Okay.
Right? Evening before it gets dark.
Okay.
Right? In emergency, you can put Sudhan Nasya anytime, day or night, because it is only Sadhya Nasya. It is not proper Nasya, Sadhya Nasya.
Proper Nasya. So these patients can take Gurshunti Nasya in the evening also. After.
Yes, when it is not possible to put it in the morning, then you can use in the evening.
Okay.
Right? There is solution to every problem.
Yes, sir.
Right? I hope I've answered your question properly. Rupali?
Yes, sir. Yes, sir. Thank you so much,
Still,
sir.
if you
I
have
have so many
problem,
questions. Yes, sir. Tell me.
if you have any question further, you can we can discuss it again later on.
Yeah. Thank you.
Right? Okay. Take care.
Sir, there is a follow-on question by Dr. Anju Chetia. She's
Yeah.
asking, can you explain indication and preparation of Shunthi Grut Nasya?
See, there are two components in the water, Sunti and Grutta. Sunti will act as a Shodhan component and Grut will act as a Shaman component. When there is a situation where you cannot decide whether patient is requiring Shodhan Nasya or Shaman Nasya, or you have decided that now Shodhan Nasya, less number of drops are required to reach the top of the head. So in that situation, you can use Gur Sunti Nasya. The combination will work wonder in this dual problem, either Shodhan and Shaman, or Shodhan and Shaman together. Right? Here, the Grutta will act as a Yogavahi Dravya. It will take the effect of the Sunti to the different layers, different part of the brain. Right? So, you are safer as well as the Shodhan part is concerned, and you are having additional benefit when there is Shaman phase is required in that patient. So that's the use of Gur Sunti Grutta Nasya. Is it okay?
Thank you, sir.
Yeah, welcome.
Dr. Yeah, okay, yeah, she's saying she has conveyed her thanks for that. And sir, we have got a question from somebody called Pallet. Somebody has joined us.
So,
Pallet.
Sanjani हो.
हेलो इसमें एक्चुअली वो टाइपिंग मिस्टेक हो गया था पल्लवी की जगह पल्लवी वो
Okay.
ऑटोमेटिकली कंप्यूटर ने ले लिया तो इससे पैलेट हो गया था इट्स ओके इट्स मी
Okay.
सर पल्लवी
Okay.
Pallavi, you don't have second account, na? Palette.
No, so actually in between one call has come, so meeting is I left the meeting, but I am able to hear the sound, but I'm not able to see the faces.
Okay,
So
okay.
again
You
I
can
have
ask the
to
question.
join, so that it may
You want
be
to
the
ask?
reason because
No problem.
Yes.
You want to ask question?
मुझे एक प्रश्न ये क्वेश्चन पूछना था कि जैसे किसी पेशेंट को बहुत दिनों तक मतलब 15 से 20 दिन तक 20 ड्रॉप डालने के बाद भी अगर यहाँ पे नहीं आ रहा है तो व्हाट इज द टाइम लिमिट कि हम लोग कितने दिन तक उसको कर सकते हैं या फिर हिमा ने लास्ट टाइम बताया था कि हम लोग उसको त्रिकटु नस्य दे सकते हैं तो कौन से टाइम पे कितने दिन के बाद हम लोग त्रिकटु नस्य चालू कर सकते हैं
See, it's all depends on the response patient gives after putting the Nasya. Right? So if the patient requires Sodhan Nasya for longer period of time, go on putting Sodhan Nasya.
20 ड्रॉप्स के बाद भी उसको यहाँ पे कुछ भी फील नहीं हो रहा है
नहीं, you should not be exceeding 20 drops.
ओके नहीं
Then in
एक्सीड नहीं
that
किया
case,
20 तक ही किया है सिर्फ
हाँ जी?
20 ड्रॉप्स ही डालती हूँ अभी पिछले 15 दिन से सिर्फ 20 ड्रॉप्स ही डाल रही हूँ मैं उसको
No,
Every
don't
day.
exceed. Yeah, don't exceed 20 drops. Number one. Number two, as I suggested earlier, you can give Sunti Pradhaman Nasya initially. 15 minutes or half an hour later, you can again put good Sunti Nasya. Right?
Okay.
That is one option. Now, if there is a cough adhikya or more samavasa in that patient, then you can use Sadabindu Nasya, 6 drops, wait for about half an hour. Then, if required, you can put Gursunti Nasya.
Or we can use the concentration. Last time you said you can increase the concentration also.
As I told you just now also, either you increase the concentration of Gursunti Nasya, or you put Sadabindu Nasya 6 drops, or half an hour later by Gursunti Nasya.
Okay.
You can use the combination at different times. Yeah, okay. Yeah. Instead of that, use Sadabindu Nasya.
Okay. Okay, sir. She is having. She is a
Ultimately,
young lady.
ultimately you have to check the response you get, from the patient. Patient should feel lightness in the head, freshness in the head, more alertness by using Sudan Nasya.
Yes, that
In that
little bit
situation,
difference she is finding.
yeah, in that situation, even Sadbindu Nasya acts as a Sudan Nasya, but on cough side, more of cough adhikya, more of some cough adhikya, or combination of more cough and along with pitta or vat.
Okay, sir.
Right, you can do that also.
Okay, sir.
Try this again after whenever you feel it is not getting cleared up, or if you feel better response. In either situation, you can share your experience again.
Yes, sir.
Right?
Yes, I want to share that case. I want to ask your opinion about that case. She is the young lady of 30 years. 30 years
This
की
is second
लड़की है.
patient. Second
नहीं,
patient
same
है.
patient, same patient, sir.
Okay. Okay.
उसको both the hands she is feeling tremors. दोनों हाथ ऐसे सामने उसको tremors आते हैं.
What's the age of the patient?
30 years. Lady.
30. 30.
30. Yes. हाँ, sir.
Okay. It could be essential tremors. She must have started since younger age.
हाँ,
Then
बहुत
don't worry
दिनों से
about
है
tremor.
उसको. She is trying
It must be
to.
there for years together.
Okay.
So this could be essential tremors. So don't worry about that. Right? But you keep in mind the possibility of Vatadikya. Tremors, any movement of anywhere in the body is because of Vat. Now, along with Vat, she could be having Kapha. So either it could be Kapha Avrutta Vat, right? Which Kapha and which Vat is involved, that's a matter of concern, Then you have to go in more detail. But it looks like Kapha Avrutta Vat. So when you are thinking about Vat and Kapha together, oil is best. And when Sudan Avastha is required, then Sadbindu is best. Once you get the Sudan Avastha is over, or Samata is over, then you can use Vachatel or you can use Anutel. But whatever you use, at least once in a week, you can keep checking the condition of the patient by using Sudan Nasya, Gursunti Nasya. It will have two effects. It will you will see the effect of Shraman or Bruhan Nasya, whether it is in excess or not. It will also nullify the excess of Shaman or Bruhan Nasya. At the same time, that will give you guidance. Now, whether patient after about a week or a fortnight, whether patient still requires Shaman Nasya or patient requires Bruhan Nasya. Or you may feel, there is excess of Shaman and Bruhan Nasya, come down, use Shodhan Nasya for a few more days. So different combination, permutation, and considering the stage of the patient, response of the patient. Right? As you practice more and more and more, you will be expert.
Yes. Now, since last 2 months, I am doing Nasya for every patient. Every
Very
day,
nice.
morning and evening, we are preparing the Nasya and doing it for all the patients.
Very nice.
Thank
Very
you so
nice.
much, sir. Thank you so much. We are really
You're
feeling
most welcome.
blessed. Thank
You
you. And our
deserve it.
patients are also feeling blessed. Thank you, sir. Thank you so
Very
much.
nice. Rather, you will find more number of patients are coming to make use of Nasya.
Yes, sir.
Because the response is immediate and no side effect. If you know how to use Nasya, left and right and center, you will be more confident and patient will be more confident. Patient will have more confidence in you also,
Yes.
right? And that's a one way of increasing your practice.
Yes.
You will be one up as compared to your rest of the colleagues practicing Ayurveda,
Yes, sir.
right?
Thank, thank you. Thank you so
Okay,
much, sir.
most welcome. Most welcome.
Good night, sir.
Good night.
So I'm sorry, but I think we'll be closing the session. We have a few more questions. Uh,
Ah,
Dr. Hema, would you want to please go ahead with that?
Snail, just take over. I am finishing off some work. Just take over.
Sir, with your permission, I want to add something.
yes, please go ahead.
When the patient comes with certain disease with us, we categorize disease in two categories. One is like, for example, patient comes with the knee arthritis,
Mm,
osteoarthritis. The
mm,
pain is continuous. So
mm,
when we start the treatment, the symptoms will go down gradually in a graphic manner, very gradually.
mm,
But
mm,
there are some cases, some diseases where there is a episodic symptoms comes. For example, asthma. There is an episode of asthma,
एक
urticaria.
minute, Snail,
Yes,
I'll come back
yes,
in a minute after.
yes. Urticaria. There is an episode of urticaria. Likewise, there is a migraine. There is an episode of migraine. So how to assess this situation, this disease is, we see the duration between the two episodes, we see the intensity of the episode, we see the area of involvement. Okay, so likewise we assess the disease. So a specific question about Dr. Upali's migraine case, once understand, once episode is coming to the peak and going, that means the only dosh to raise that episode to the peak is Vayu dosh. If the Partiloman of the Vayu is there, then only and then only the disease will come in the episodes. So if we are seeing the patient of migraine and patient is with triggers is getting the migraine, for example, every week. So in after 10 days of our Nasya treatment, if patient says that now the episodes are coming in 15 days of time, that is the improvement. Still understand episode are coming. So Pratiloman has not come down. Patient after some time says that episodes are coming in 1 month of time. So the duration has increased between the two episodes. Still Pratiloman of the Vayu has not come down. If patient says
So,
that after with
sorry, sorry,
triggers,
sorry,
it's okay, sir. I was just
sorry,
explaining
Snail.
about
मैंने can you repeat your question, please? एक minute पानी पी लो.
yes, sir. I'm not repeating the question. I'm just explaining about the Pratiloman of Vayu. I'm trying to explain. So it was about Dr. Upali's question about migraine case and number of drops taking more time. So I was explaining about there are some diseases which are in an episodic manner, like asthma or urticaria or migraine, for example, in which the disease will come in an episode. So if patient is complaining that in initial on day one that my migraine comes every weekly basis, so what happens in that weekly basis is when Pratiloman of Vayu is high, then the episode will come. So in after 10 days time, if patient says that now my migraine is coming after 10 days of time instead of 7 days, so now we understand that Pratiloman is still there, but it has reduced to a manner. If next time patient comes and says that the now episodes are in 30 days of time, if episodes are coming, that means that Pratiloman Vayu has not been done completely take care of. After patient says that there are no episodes of migraine, that is the only time that Pratiloman has come down, but disease has not been cured, pathology has not been corrected still. So at that time also we start uh, give the Nasya continuously. I'll give a simple example. When we go and switch off the fan, switch off the button of the fan, immediately fan will not switch off. It will take 20 seconds of time to switch off. So when we switch off, that is the episodes have stopped. That is Pratiloman has stopped now. But now After Pratiloman has been stopped, it is Anuloman. The direction of the Vayu is in the Anuloman. Now we correct the Strotas, we correct the Sthana, we correct the Dhatu involved. And in that time, Shodhan Nasya will be required, and it may take 6 months of time, sometimes even a year of time. I was a personally case of sinusitis at Sir's clinic. I took 1 year to reach 20 drops to 1 drop. So it takes time, but how much the pratiloman of the Vayu we need to see, and if episodes of migraine are coming, it means the pratiloman is not taken care of, either due to lack of treatment, that is very lesser possibilities when we are doing with the Ayurveda way. Second, more important is the pathya of the patient. If the patient is doing apathya, pratiloman will come slowly in a manner. So we need to take care of the pathya also. So episodes are coming, that means pratiloman has not stopped. Once episodes are stopped, that only indicates that pratiloman is now in the anuloman direction. You need to work more on the second stage of shaman and bruhan. That was I was explaining.
Very good. At the same time, Snail, I will add 1 or 2 points more. Make sure the patient is not on any allopathic medicines or homeopathic medicines. Otherwise, there will be masking effect, or there may be additive effect. In between, there may be an episode of pratilomat Vayu. So make sure patient is not on allopathic medicines or any other medicines. Number 1, patient has observed the diet properly in due course of time. Third, very important, see the mental status of the patient. When the patient is apprehension is there are chances that Vat will increase, or Pit will increase, or Vat and Pit both will increase. So make the patient feel comfortable by giving appropriate Shaman or Bruhan Nasya. Then automatically the episodes of Pratinomit Vayu would reduce considerably. That's all.
Sir, there are questions from, I think, hand raises from Sajjala, and I can't see the other doctor. I can just see a raised hand. I think
There is
from
a,
Dr. Tuppad.
yeah, we have got
Uh,
raised hands from Dr. Sajjala, Dr. P. Kothalkar, and Dr. Praveen Tupad.
Okay.
Sir, how long do we want to prolong? It's already 10 minutes to 11. So we can take one question and put the questions next time, or what do we do?
Up to 11 o'clock is okay. 10 more minutes.
Okay.
Then we I don't know whether next session is required or not. On Nasya.
So
That
we can,
depends on questions, sir.
so we can go with Dr. Sajjala, because yeah, that's
She's
she's been
living
there
far
in
away.
queue.
She's living far away.
Okay. Yeah, Dr.
Yes,
Sajjala,
Sajjala?
please.
हेलो, नमस्ते सर।
Namaste, Sajjala. How are you?
अच्छी हूँ।
You are not to be seen. Switch on your Snail.
I have
Video.
switch on.
Video.
I have opened.
So we can see her. Yeah, Dr. Sajjala, we were able to see you.
Okay.
Yeah, just a minute.
सर,
Yeah.
सर कभी कभी जब
Yeah.
हम विश्वाघृत या फिर पंचगव्य घृत नस्य डालते हैं, उसके बाद हमें बहुत सारा कफ का निर्मूलन होता है, तो ऐसे में क्या समझना चाहिए कि उस व्यक्ति में काफी लीन दोष है?
Can you come again?
Yes. सर कभी कभी पंचगव्य घृत नस्य या फिर विश्वाघृत, ये शुंठी घृत नस्य डालने के बाद में प्रभुत मात्रा में कफ का निर्मूलन होता है, कफ निकलता है बहुत सारी मात्रा में, तो ऐसे वक्त हमें क्या समझना चाहिए कि उस व्यक्ति में काफी मात्रा में लीन दोष है?
There are 3 possibilities. One is there is excess of cough. Urdu Jatrukat, excess of cough in sinusitis, chronic sinusitis or acute on chronic sinusitis. Or then there can be cough associated with Vat. So there'll be prolonged problem of sinusitis. Number 3, more samavastha of cough and vata. So lot of phlegm will come out, lot of discharge will come out through the nose or maybe from the mouth. So ये 3 possibility है.
लीन दोष की पॉसिबिलिटी नहीं है.
लीन दोष हो या नहीं हो, वापस रिकरेंट होता है या तो एलर्जी भी होती है ना.
ओके,
राइट. तो पहले आप उसको चेक करिए कि उसके वातानुलोमन है या नहीं, भूख अच्छी लग रही है नहीं. सो इन बिटवीन शुंठी प्रदमन भी यूज कर सकते हैं टू चेक where the patient belongs to, which category patient belongs to. That will give you a guidance, whether more Shraman is required or more Shodhan is required. Or you can also use good Sunti Nasya in between.
Okay.
ठीक है. फिर भी नहीं जा रहा है, then you can use Shadbindu Tel Nasya. Right? And after using 2-3 days of Shadbindu Nasya, again, once in a while, you can use good Sunti Nasya, Shodhan Nasya. Fine?
Yes, sir.
What else?
Thank you, sir.
Are you practicing Nasya properly?
Yes, sir. Every day. Every day we
Very
are
nice.
making.
Very
good
nice.
Shunti.
Very nice.
Different
Very
also.
nice. Very nice. Carry on, please. Okay, ma'am. Okay. Take care.
Sir, the next question is from Dr. P. Kothalkar.
Yes.
I'm sorry, you're on mute.
Okay.
I can unmute.
Yes. Hello, sir. Hello, sir.
Hello, hello.
हाँ, हेलो सर. सर मेरा क्वेश्चन ऐसा था कि पीसीओएस के
I
पेशेंट
cannot see
में.
you. I cannot see you.
नो सर, माय कैमरा इज ऑन.
Just a minute. Just a minute. I'll correct that.
Yes, there you are.
Yes, sir.
Yes.
Yes, sir. Hello, sir.
Hello, hello. Tell
2
me.
times in a day.
What 2 times in a day?
सर आज 5 बजे हम लोग ने बात भी की थी ना फोन पे.
Uh-huh.
और अभी हम फिर से मिल रहे हैं इसीलिए.
Okay, okay. Very good. Very good.
सर मेरी पेशेंट है, पीसीओएस है, उसे शोधन की जरूरत तो है ही. वो आउट फ्रॉम उस्मानाबाद है, वो अभी यहाँ पे बस्ती कराने के लिए आई है. तो मैं उसे योग बस्ती करा रही हूँ, लेकिन उसके साथ मुझे पता है कि उसे शोधन की जरूरत है. जैसे जीवा से, पुरुष परीक्षण से, एब्डोमिनल एग्जामिनेशन से. तो क्या उसे बस्ती के टाइम पे भी हम लोग नस्य कंटिन्यू करा सकते हैं?
I feel PCOS and PCOD doesn't require basti immediately.
Okay.
The cause of PCOD, PCOS is what?
HPO axis.
HPO axis. That means no enough amount of enzymes are secreted for the periods to become normal. So first you correct that HPO axis, right? The correction is by only Shodhan Nasya to begin with. When that gets cleared, then only you may think of Basti Chikitsa. Yeah, Basti Chikitsa.
Basti.
If there is associated Pitta, then the things would differ completely. If it is associated with Vata, again it will be different. If it is associated with Kapha, it will be different. And combination of Samavastha and Niramavastha, again it will be different. But at least in a given case, you can start with a Shodhan Nasya.
Okay.
Then you see the response. I'll tell you one more example. When patient is having DUB, dysfunctional uterine bleeding, excessive or menometrorrhagia or menorrhagia, what do you think of?
Again, Nasya.
Any what problem? Samprapti. Excessive bleeding. Every
पित्त
15 days.
प्रकोप है.
Very
पित्त
good.
प्रकोप है.
It's not only pitta prakop. It is
वात
pitta
and
and vata.
वात.
Not only pitta and vata. Think of samavastha of pitta and vata.
Yes,
So
yes,
that
yes.
samavastha component you should be tackling with Shodhan Nasya initially. Once samavastha settles down, then the flow, excessive flow can be reduced. Then you can use Saman Nasya or Brahman Nasya. So you have to correct HPO axis. So answer is there.
Okay. Okay, sir. Okay. Thank you. Thank you, sir.
Okay. Welcome.
So we are at 11. So we have a question by Dr. Praveen Tuppad.
Yes, Praveen.
You want to go ahead, sir?
नहीं मेरा
Okay.
Yes, please.
सर मेरा क्वेश्चन नहीं था सर, बताने का था सर। मीन्स वो नस से जब भी पहुंचता नहीं है ना, प्रधमन जैसे आपने बोला, तो
Put on
आई
the,
यू
तो ओपन अप करो ना, अनम्यूट करो और दोनों को करिए।
अनम्यूटेड है सर। ठीक है सर।
नहीं दिख रहा है, फेस नहीं दिख रहा है। हाँ अभी ठीक है।
हाँ सर।
यस प्रवीण।
हाँ यस सर। आई से टू पेशेंट टेक स्टीम सर,
ओके,
that increases little bit of efficiency of pradhaman and good shinti of mind. जो लोग बोल
वेरी
रहे थे ना
नाइस,
20 नहीं पहुंच
वेरी
रहे।
नाइस। आई वाज टू suggest this at the end of this lecture, that in not only steam but little snehan and swedan before starting the nasya. Little swedan, I mean snehan and shaman, snehan and steam, right, before putting any nasya. That would facilitate the easy entry of the nasya into the creases or into the smaller spaces in the brain.
Yes, that helps a lot sir, for me
That
at
helps a
least.
lot. Very nice, very nice. Good point. I was to
And
suggest
no
it at the end of this.
sir, never sir use in it is said kid don't use plain water steam, put something in it. So I always say put some tulsi, pudina, or even if you have a divya dhara, very light, very less light
Yes,
quantity,
yes. But
to
before
remove
that,
that.
you give little sneha
Sneha.
massage
Okay, okay sir.
with the oil.
Okay,
Massage with the
fine.
oil, then followed by even by this also.
Yes sir.
Yes, you know, if you're not using steam, or if there is
Steam.
no possibility of using steam, apply little oil, whatever oil, then
Yes.
this friction and this heat also will be useful.
Yes.
Right? Good point.
Just wanted to say that कि yes
Very nice,
बरोबर
very
था
nice.
या नहीं था करके just बताने के।
एकदम बरोबर है, एकदम बरोबर है.
Okay,
In fact,
sir.
we should be using the same method every time whenever it is possible.
Thank you, sir.
Snehan and Swedan, external Snehan and Swedan. What we do in regular Panchakarma Chikitsa, this can be done, but it is not mandatory, because we are
Yes sir.
using Sadhya Nasya.
Sadhya Nasya.
It is
Only
not
just
mandatory. But if there is possibility, you should be giving Snehan and Swedan before giving
because
Nasya.
those doses were getting increased na sir. So I
Yes.
thought so rather than we can do this way.
Yes, yes,
Just
that
to
can
reach
be
it.
used. Yes, yes, can be used. Right? But
Okay.
make sure it is not mandatory.
No sir, not mandatory sir.
No,
Never
I'm
mandatory.
talking to everybody. It is not mandatory.
Okay.
Because we are using Sadhya Nasya. Don't wait to use Nasya in view of, apply oil, then steam. Don't wait. Start putting the Nasya. Right? Clear?
Yes sir.
What else?
Thank you, Dr. Praveen Tuppad, for that. So I think we have finished all the questions from all the participants, and I would want to thank everybody here who has come and shared their questions, and also a big thanks to Dr. Gala uh, for his guidance to everybody.
Thank you
And
very much,
yeah,
Anand, to give us support in this group. Thank you so much, Anand.
sir,
And
it's a privilege.
everybody, thanks a lot for taking active participation in the lecture. Yes, Hima?
Okay, Hima.
Yes, Hima?
I think, sir, we'll meet next week then.
Okay,
Ashish
so
sir,
yeah.
but so everybody can like say by next week મળીએ આપણે.
એમ મળવું છે?
If they have doubts, or then we take another topic and start.
Hima, I feel Sadhya Nasya to will go in lot of details now. Lot of details with different permutation combination, yet Sadhya Nasya. હવે બધાને રસ જાગ્યો છે ને? ક્વેશ્ચન હશે તો આપણે લઈશું પાછું.
Okay, sir. Okay.
Yes, Neil?
Yes, sir.
બીજું કઈ વાત કે? Special thanks to
Okay.
Anand.
No, sir, nothing, sir. It's a privilege.
Okay, thank you so much.
Okay, so we can close the session, and thanks everybody again. Yeah.
Okay,
Wish you all a very good night.
Thank
Okay.
you. Thank you.
Yeah.
Same
So
to
closing the
everybody.
call.
Okay.
Good
Bye-bye.
night.
Good night. Good night.
Good night, everybody.
Good night.